Hello there, my name's Alex Chapman. I'm a women's health physiotherapist and Pilates teacher, and I've been practicing as a physio for 17 years and teaching Pilates for 12 years. I work in the NHS in England. I also run my own private clinic and studio called Enliven Health, which is just outside Milton Keynes in a little village called Salford in England. I'm a mum of two, and since having my own children, I developed a real passion and enthusiasm for women's health and wellness. And as time has gone on, I now specialise in treating ladies who have a wide range of problems with their pelvic health, including conditions such as urinary incontinence and dysfunction, pelvic organ prolapse, bowel problems, pelvic health conditions including endometriosis, the pregnant and postnatal lady, and I also see women who have had pelvic surgeries, whether it may be for cancer or hysterectomy, caesarean section, or for prolapse. I am fully certified in mat and equipment Pilates, and I am a member of the Pelvic Obstetric and Gynecological Association for Physiotherapists based in the UK, and I am passionate about bringing together my two loves, which are Pilates and women's health. So welcome, and I'm really excited to be presenting the introduction to a brand new and wonderful course, which I have had the absolute pleasure in writing and developing in collaboration with Mbodies Training Academy based in the UK. So this course is bringing together my two absolute passions, which are Pilates and women's health. And as a women's health physiotherapist, this is something I have been working in and specialising in for several years now. And I see women with a variety of issues, ranging from incontinence to bowel problems to pelvic surgeries, conditions during pregnancy and the postnatal period. And it's a big problem that we're having in the UK with regards to women, the symptoms that they're having, and the huge impact that pelvic health problems have on this client group's quality of life. So why does pelvic health matter? Well, 50% of the population are female. And most of the clients that we see as Pilates teachers are also female. And although this is starting to change and more men are, realising that Pilates is great for guys as well, most of the clients that we tend to see are ladies. And we also know that 1 in 3 women in the UK will have some kind of pelvic health dysfunction at some point in their lifetime. So that might vary from urinary incontinence or a little bit of leakage during coughing or sneezing or moving around, to more severe issues, including pelvic organ prolapse, which have the potential to be really debilitating and really impact a woman, not just on a physical level, but on a psychological and psychosocial and emotional level as well. Not to mention the costs of these problems on our health system. So we know that in the year 2017 to 18, just pelvic organ prolapse alone cost the NHS £45 million. And that's just in 1 year, and that's on treatments and surgeries. And so the cost implications for these conditions are absolutely immense on the health service, but also on the individual who is experiencing these symptoms as well. So a lot of women have these problems, but they don't talk about them. And they're afraid, they're embarrassed, they don't want to speak to their GP about the fact that they might leak, or they might be having bowel problems or pain during sex. So where do these women go? I mean, a lot of them don't realise that help is available on a physiotherapy level. And as Pilates teachers, I really feel that we are perfectly placed to help and educate and inform these women who might be having symptoms. They come to see us, they're comfortable with us, we provide them with a safe, welcoming environment and safe space that is friendly, where they know people, and they might be more comfortable in divulging and talking about some of the symptoms that they may be presenting with. And it may be that in the past, perhaps you've had clients either during classes or perhaps before or after, who have, sort of told you that they might be having X, Y, or Z. But can you always tell them what they should be doing, or where they should be able to seek really good, effective treatment for these problems? So I think as Pilates teachers, we are in a great position to be able to really support and help and provide a better service and offering to these women. And so pelvic health, or female pelvic health, because we're really specifically focusing on the female client and the female pelvic health conditions. And I feel that it's a really important area and something that we have the capacity to build our knowledge and develop our understanding to improve the level of service that we can provide. So what does this course involve? Well, it's a brand new evidence-based course, which is really going to go into detail. We're going to be looking at up-to-date research evidence into the function and anatomy of the pelvic floor and core, and how this might apply in our Pilates practice. So how does the core work as a system when we breathe, when we move, when we exercise? How we might be starting to recognise if the clients that we're seeing could be demonstrating with pelvic health signs and symptoms that we need to be aware of as Pilates teachers. So we'll be looking at the screening process, we'll be looking at what questions we need to be asking these women about their symptoms. We should be looking at potential more concerning signs and symptoms that these women might be having that might indicate that perhaps we might not be the best practitioners to be seeing them at the moment, and perhaps they need an onward referral. We'll also be looking at specific pelvic health conditions. So we'll be looking at all the different types of pelvic health conditions, or a lot of the different types of pelvic health conditions that a woman could be presenting with, without us necessarily knowing if they might have these problems or not. So conditions including urinary incontinence, pelvic organ prolapse, bowel issues. It's useful to know if women have had pelvic surgeries in the past, if they're pregnant, if they're postnatal. So all of this will be covered in an evidence-based approach. So we'll be looking at what the evidence has to say. So the research evidence into Pilates and how it might be helpful or not helpful in helping to manage a woman who has pelvic health dysfunction. We'll also be going on to look at how Pilates programming can be brought into this client group, whether it may be in a class setting or in a one-to-one, more kind of rehabilitative format. So the course is divided into 4 different modules. Now, these modules can be taken as individual standalone modules in isolation. Or you might feel that you want to take all of the modules together, and this will sort of form the whole course structure, and you'll obtain a pelvic health and Pilates qualification at the end if you decide to do it in this way. So 4 distinct modules. So module number 1, we'll be talking about the pelvic floor and core, and we'll be going through the anatomy and the functioning of the pelvic floor muscles and the associated tissues, including the nerves and the bones and the ligaments and the fascia. And we'll be really going into a lot of depth in terms of how everything works together. So how do all these muscles work as a system, as a unit, to provide us with efficient movement and stability and efficient breathing strategies and efficient ways of, defecating or urinating or being able to have normal pain-free intercourse. So we'll be looking at all of these different things. We'll be looking at how to identify and what processes we can use to help identify if clients have issues. And how we need to start thinking about incorporating these issues into our Pilates practice. Module 2, we'll be looking at dysfunctions, so specific dysfunctions in pelvic health. So dysfunctions including incontinence, bowel issues, prolapse, pelvic surgeries, pelvic pain. So again, we'll be looking at what the up-to-date research evidence has to say about these problems, and then bringing in more recent research into Pilates and how Pilates exercise may or may not be useful in helping a woman to manage the symptoms that she might be experiencing from these more specific conditions. So we'll be looking at example classes, we'll be looking at case studies, practical workshops to really tie in and consolidate your learning and knowledge in this area. Module 3 will be going into diastasis rectus abdominis. So although this is more of a core dysfunction, there could be links with pelvic health when a woman has a diastasis. And there's more and more awareness, a lot of online information out there now. So a lot of women are more concerned about this problem, particularly in the postnatal period, and whether they might have a diastasis. So we'll be looking at how to identify and how to assess a woman for a diastasis, and then what to do if we do discover that she might have one. Where do we need to go from there? Can we carry on with our Pilates practice? And if so, what techniques and what exercise strategies and programming strategies can we use to help her to recover and rehabilitate? Or is it something that perhaps needs onward referral to another practitioner or health professional? Module 4 will be going into more functional programming. So the title of the module is Functional Pilates Programming in Pelvic Health. So it's more of just thinking a little bit more outside the box. We'll be looking at what your client goals and needs are. Where do they want to be? Do they want to be running? Do they want to be dancing? Are there any specific hobbies, or do they do any particular work that they really want to be sort of tailoring their Pilates program towards to make things more functional and more applicable to what they're doing on a daily basis? So we'll be thinking more along the lines of functional progression in your Pilates practice, how to move women on, what we need to be aware of when we're progressing women, what signs and symptoms women might demonstrate with that might indicate that perhaps we might be overdoing it with them. But we also need to be thinking about other areas. So from a cardiovascular point of view, a lot of women want to feel like they're working hard. We know that cardiovascular health in women is extremely important. Heart disease is a big killer in women. So should we be thinking about bringing in more cardio-based options in our Pilates practice? And if so, what kind of things could we be thinking about? We'll also be thinking a little bit more about more upright, more standing, more functional-based Pilates to incorporate bone health issues, which again are a big deal in women, thinking about bone health, osteoporosis. So although we're thinking a little bit more externally, it sort of does tie in with pelvic health as well. Because a lot of women who we see want to move on, they want to progress, and we need to be tailoring our programming strategies to be able to accommodate our clients' needs in this regard. So we'll be looking at different workshops, different types of Pilates practice and different example classes that we might want to include for certain clients and certain women that we see. So that is the outline of the course content and the different modules. So what are the aims of this course? So I mentioned quite a few of them already, but really what we want to be doing is to develop and increase your level of knowledge in pelvic health conditions. So how to potentially identify if someone has a pelvic health problem, what symptoms to look for, how might this present in this client. Really develop your level of knowledge with respect to latest research evidence. We also want to be able to recognise the importance of the client screening process. So in pelvic health conditions particularly, it's really important that we have links with other professionals, that we know what our limitations are as Pilates teachers. So what are concerning signs and symptoms? What are red flags? When should we be referring these women on? So these are really important parts of our practice, knowing what our limits are, knowing where our scope lies, and it really does enhance your overall standard of care and standard of service that you can provide to these women if you understand where your limitations are and when you need to refer on. So we're going to be also, so another aim is to really explore the practical elements. So like I've mentioned, we'll be looking at lots of different example classes, lots of different ways that you might be thinking about regressing or progressing your Pilates programming, looking at different Pilates repertoire and how you might use that in pelvic health conditions specifically. So really what we want to be doing and what we're aiming for is to provide you with a toolbox, both from an assessment and an exercise strategy point of view, where you can take this information and you can go and use it straight away in your classes, in your one-to-ones, and you can just put it into practice from the get-go. And you should hopefully feel like your practice has changed and developed from doing this course. So finally, one of the other aims of this course is to challenge your thinking as a Pilates teacher. So we're going to be looking at reflection, where you feel you are at the start, where you feel you've developed to by the end. Challenging your thinking and recognizing that we don't know it all, and it's good to develop, it's good to change. You might have light bulb moments of things that you have done for years and years, and you might think, oh, actually, perhaps there's a better way I could be doing this, or maybe I shouldn't really be doing this with certain client groups. So we really want to be trying to challenge your practice and thinking, and really help you to hopefully move your Pilates practice on and progress and develop yourself as an individual and as a Pilates teacher. So how do you know if this course is for you? Well, this course is suitable for you if you are a Pilates teacher and if you work with the female client. If you would like to develop and expand your knowledge in pelvic health conditions, how to recognise them, how to use exercise strategies and repertoire and Pilates programming to enhance your offering to the female client, and particularly those who have pelvic health conditions, then this course is also for you. If you would like to progress your knowledge in latest research, and get up to date with the latest research findings about pelvic health conditions, and particularly how Pilates may tie in with pelvic health conditions. Also, if you would like to challenge your own practice and teaching and ways of thinking with regards to what you're currently doing, then this course is certainly for you. If you would like to have lifelong access to ongoing support through a Facebook group where we can continue to have peer discussions and where we can share latest articles and evidence and just have general discussions going forward, then again, this course is for you. So hopefully that is enough to entice you into booking onto this course, and I look forward to you joining me soon.